My name is Samantha Guerra, and today I will be talking about reproductive cancers. What is ovarian cancer? Ovarian cancer is a cancer that begins in the female's ovaries, which produces eggs. Ovarian cancer often goes undetected until it starts to spread within the pelvis and the abdomen. Ovarian cancer causes more deaths than any. With more than 200,000 cases being diagnosed each year worldwide, ovarian cancer is the sixth most common tumor found in women. Out of every 3 women diagnosed. Some facts about ovarian cancer are: it is the #1 killer of all gynecological cancers. 40% of the women with the mutation on their BRCA genes have a lifetime risk of up to 40%. There is no test for early detection. 70% of cancers are caught in either stage 3 or stage 4. 90% of the cancers caught in stage 1 have a 90% chance of survival. 1,500 women die of ovarian cancer each year in Canada. 90% of women die within 10 years of diagnosis, with 70% of women dying within 5 years of diagnosis. Some symptoms of ovarian cancer include fatigue, persistent pressure or pain in the abdomen or pelvis, weight gain, frequent or urgent urination, back pain, gas, changes in bowel movements, painful intercourse, vaginal bleeding, bloating or swelling of the abdomen, difficulty eating or feeling full quickly. Ovarian cancer is called the cancer that whispers because symptoms are often too easily dismissed. A pap smear cannot detect ovarian cancer, and ovarian cancer research benefits advances in breast cancer since many breast cancers are related to estrogen, a hormone produced by the ovaries. The reverse is not true. The cause of ovarian cancer is unknown. There are ways to reduce your risk of ovarian cancer. These include carrying a full-term pregnancy, taking oral contraceptives, breastfeeding, maintaining a healthy lifestyle, and a surgery to remove the ovaries. Some symptoms are that ovarian cancer can be easily detected early if the symptoms were being reported more often. Symptoms of ovarian cancer are often dismissed and thought of as a vague complaint. If ovarian cancer was detected early, women would have a 94%. One factor can be our physical health. Our weight and body mass index is proposed to alter our endogenous hormone levels that could spark the growth of the tumor in our ovaries. A second factor can even be fertility drugs. Clomiphene citrate, a drug for women with an ovulatory infertility, can be a factor as well. The agent is a selective estrogen receptor modulator that increases estradiol and progesterone levels that have been. Detection. Today, more than 70% of the women with ovarian cancer are still not being diagnosed until it reaches stages 3 or 4. In the photo below, you will see the stages of ovarian cancer. Before ovarian cancer, there are healthy ovaries. In stage 1 of ovarian cancer, the cancer is confined to one or both ovaries. In stage 2 of the cancer spreads within the pelvic region. In stage 3 of the cancer spreads to other body parts within the abdomen. And finally, in stage 4, the cancer spreads. The pelvic exam doesn't have the ability to feel the ovaries or any cancers on them. Even more so, when women reach menopause, their ovaries shrink and become. Other ways to detect ovarian cancer. Transvaginal ultrasound. A transvaginal ultrasound can get a detailed image of the ovaries to clearly see any cancers. The ultrasound is done by the doctor inserting a probe in the vagina. And if there is a mass, the ultrasound will pick it up. Unfortunately, it isn't used as often as a mammogram. Unless it's approved for routine, insurance companies won't pay for the procedure, and many doctors don't suggest. Another way to detect ovarian cancer would be better blood tests. Better blood tests can also be beneficial for early detection of ovarian cancers. There is a blood test called the CA-125, which is already being used to see if women are responding to chemotherapy or to also see. Using both the transvaginal ultrasound and blood test can produce better results in the research. Using the blood test normally to keep track of any abnormalities leads to the use of the ultrasound in case the woman gets in the high risk range. In the photo below, you will see the late diagnosis results in poor survival. If diagnosed at the localized stage, the 5-year rate is 93%. However, only about 15% of all cases are diagnosed. The main treatments for ovarian cancer are surgery, which removes the actual tumors out of the body, chemotherapy, which is a drug that kills cancer cells but also damages normal cells. Some side effects include nausea and vomiting, loss of appetite, loss of hair, hand and foot rashes, and even mouth sores. Hormone therapy is the use of hormones or hormone-blocking drugs to fight cancer. This is more often used to treat ovarian stromal. There's also targeted therapy, which is a type of cancer treatment that uses drugs or other substances to find and attack cancer cells with little damage to the normal cells. And lastly, there is radiation therapy, which uses high-energy X-rays or particles to kill cancer cells. Some of the side effects include skin changes, fatigue, nausea, and vomiting. Prevention. Factors linked to a lower risk of ovarian cancer include pregnancy, breastfeeding, birth control pills, having your tubes tied, removal of the uterus without removing the ovaries, which is called a hysterectomy, and listening to my presentation. Here are all the sources of all my. Thank you for listening.